And as you can imagine, we've been getting buried under an avalanche of your health care questions. Poppy, along with everybody else, we're trying to sift through the pile, answer them to the best of our ability. Well, today, manning our health care desk is Ken Thorpe. He joined us last week. You may remember he's the chairman of the Rollins School of Public Health at Emory University. Good to see you, Ken, and I want to get as many questions in here as possible, so I'm going to get right to it, okay? Okay, great. Here we go. This one comes from Camille. I have insurance through my job, but it's a plan that we all hate. Will I have the option of switching to a better plan without paying a ton more?
Well, if you work for a smaller company, let's say under 100, when the health insurance exchanges come into play in 2014, you could switch and buy coverage through those exchanges, which will give you a broad choice of health plans, some with higher cost sharing, some with very, very low cost sharing. And even if you work for a bigger company, you can get a voucher from your employer to basically take that dollar that the employer was contributing for your coverage and again take it through the exchanges. So there will be a lot of options for most employees in this country.
Okay, well, that's good news. Here, Samuel wants to know, for those of us with medical conditions that are without jobs or health insurance, what constitutes or qualifies us to the, quote, critical pool, and how soon can we see any sort of assistance?
Well, I think this is one of the good news of the reform effort is that within the next 90 days, there will be a national high-risk pool available for individuals if they meet two conditions. One is that they have to be uninsured for 6 months. And second, you just simply have to have a pre-existing condition like asthma, diabetes, heart disease, cancer, and so on. So look for that within the next 90 days.
This coming from Michelle. Is there a definition of whom companies will be required to offer health insurance to? I can see many companies dropping people to part-time status to avoid being required to offer them health insurance.
Well, in 2014, if you're an employer that has 50 or more workers, defined as full-time workers, or working 30 hours or more, and even part-time workers, if you have two 15-hour-a-week part-time workers, that's one full-time worker. They'll either have to offer insurance or pay a penalty. For that employer of 50, the penalty would be about $40,000 if they don't offer coverage. Obviously, if they do offer coverage, they'll have to contribute towards the cost of the premium.
All right, one more. Sound all right?
Oh, absolutely.
Okay, here we go. This coming from Jay. Will permanent residents and illegal immigrants be included in this medical coverage? We actually have had a number of people asking that question.
Well, that's a good question. U.S. citizens and legal residents will be covered. If you're an illegal immigrant, you're not covered through this health care plan. You can't even really buy coverage with your own money through the plan. So it's just focusing on U.S. citizens and legal residents.
Ken Thorpe, chairman of the Rollins School of Public Health at Emory University. We'll talk to you again hopefully this week. Thanks,
okay.
Ken.
Thank you.
All right.